Hey there, folks. Welcome back to the channel. Today, we're diving into a serious topic that's making headlines: the rise of flesh-eating bacteria infections in Louisiana. Now, this might sound like something straight out of a horror movie, but it's a real concern for public health. So, let's break it down and see what's going on. First off, what's this Vibrio vulnificus we're talking about? Well, it's a type of bacteria that naturally lives in warm seawater. It's not something you'd typically think about when you're enjoying a day at the beach, but it can be incredibly dangerous. According to the Louisiana Department of Health, 9 people have contracted Vibrio vulnificus this year, and unfortunately, 5 of them have passed away. That's a pretty stark increase from the average of 7 infections and 1 death per year over the last decade. Now, here's where it gets interesting. The warming waters in Louisiana are pushing these cases farther north. That means that areas that weren't previously at risk are now seeing an increase in Vibrio vulnificus infections. It's a bit like a creeping shadow, slowly expanding its reach. And it's not just Louisiana. Other states along the Gulf Coast are also seeing a rise in cases. So, what's the deal with this bacteria? Well, it's not just about the warm waters. It thrives in salty environments, which is why it's often found in shellfish and other seafood that's been contaminated. But it can also enter the bloodstream through open wounds, leading to severe infections. And here's the scary part: Vibrio vulnificus can be fatal, especially for those with compromised immune systems or pre-existing health conditions. Now, I want to talk about why this is such a big deal. First of all, it's a reminder that nature can be unpredictable and dangerous. We often think of the ocean as a place of relaxation and fun, but it's also a complex ecosystem that can harbor harmful organisms. And it highlights the importance of public health infrastructure. With more people spending time in the water, the risk of these infections is only going to increase unless we take proactive measures. But it's also a call to action. We need to start paying more attention to the health risks associated with our coastal environments. That means better education and awareness campaigns, as well as improved water quality monitoring. And it's a reminder that we need to take care of our oceans and the ecosystems they support. After all, we're all interconnected, and the health of our planet is directly tied to our own well-being. So, what can we do about this? Well, for now, it's all about personal responsibility. If you're heading to the beach or swimming in the ocean, make sure to take precautions. Wash your hands thoroughly after handling seafood, and always cover any open wounds. And if you're a local resident or business owner, get involved in community initiatives to improve water quality and public health. Every little bit helps in the fight against these flesh-eating bacteria. In my opinion, this story is a wake-up call for all of us. It reminds us that we need to be more mindful of the environment around us and the potential risks it poses. And it's a call to action for policymakers and scientists to work together to find solutions. Because in the end, it's not just about protecting ourselves, it's about protecting our planet and each other. Thanks for watching, and stay safe out there.